Our second speaker is Dr. Elsie YAN. She is the Associate Head of Department of Applied Social Science, the Hong Kong Polytechnic University. She researched on elderly abuse, dementia, caregiving, and elderly sexuality. Dr. Yan will share with us the topic, elderly abuse in minds of COVID-19. Dr. Yan, please.
Right. So this is me and Professor Lai. Professor Lai is actually the principal investigator of this project, but I'll be sharing the results with you today. COVID-19, first case was identified late last year, and then up till now, close to 60 million of people were confirmed, and 1.4 million deaths has accumulated. Authorities across the world have used all sorts of strategies trying to stop the illness, the disease from spreading, from social distancing measures to complete lockdown of cities. And early on in the pandemic, I received this screening test to see how risky you are if you are a confirmed, or how risky you are to die if you are a confirmed case. And I'm going to share that with you. So, how many of you could identify the association between these two objects? Okay, you don't need to tell me. What happened is COVID-19 do affect people of different age groups differently. Apparently, death rate is much higher among those in advanced age. And so there is this association between COVID-19 and elder abuse. What we think is that it exacerbates the impact of some known risk factors. And then it also creates new opportunities, new avenues for elder abuse. And COVID-19 also brought our attention to some of the long-standing discrimination or disadvantaged positions of older people in the community, and those we will discuss in this presentation. So, where I mentioned earlier that COVID-19 increased some of the risk factors, one of those would be the result of work from home arrangement. So, since earlier this year, many companies offered work from home arrangement to the employees, and two of the smaller surveys done in Hong Kong suggest that only 1 in 10 persons were offered such arrangement before the COVID. But then after the COVID-19 pandemic, close to 90% of them were given the opportunity to work from home. And some of my previous research suggests that co-residing days is a risk factor for elder abuse. So we could guess that, like, people spending more time at home may result in having more opportunities for interpersonal conflicts within the family and could potentially lead to increased elder abuse. And at the same time, due to the COVID-19 pandemic, a lot of public services have been stopped. And obviously, caregiver stress is a major risk factor for elder abuse. And given that the care responsibility, normally caregivers may receive home help such as meal delivery, daycare services, respite services. But when all those services are haunted during the pandemic, the care responsibilities fall back on the families. And that may impose extra stress to the family caregivers that are already stressed. So in this study, we conducted a telephone survey with a representative sample of 1,200 community dwelling older persons who are aged 60 or above. And they provided information on their demographic characteristics, perceived disruptions brought about by COVID-19, family relations, physical and mental health, PTS symptoms, perceived safety in the community, etc. These are the demographic characteristics of our respondents, pretty evenly distributed across different age groups. Most of them female, married, and most receive secondary level of education. Living arrangement, it doesn't add up to 100% because obviously you could live with both your spouse and children at the same time. So most of them were living with their partner and most of them with their children. So this is the prevalence of discrimination they perceive, they experience in the community, as well as various forms of domestic violence. So this rate were actually comparable and a little bit higher than the rates we observed in other studies of elder abuse. And encouragingly, although a large proportion of people reported they experienced some sort of discrimination in the community, a sizable proportion of them also reported improved family relations after the pandemic. So we conduct, I'm sorry, this is a very busy slide. And so we conducted a series of logistic regression looking at factors associated with discrimination, domestic violence, and improved family relations. So it appears that people in the young old group, people of the female gender, and those who reported more financial strain, they were at much higher risk of experiencing discrimination and abuse. And the opposite is true for improved family relations. We measured various types of COVID-related disruptions. Those were not significant in the logistic regression, but if we look at the correlation matrix, they were actually significantly associated with abuse and discrimination. Right, so, well, as mentioned earlier, discrimination and abuse were common, but then many people also reported improved family relations. And we originally expect COVID-related disruption would be a good predictor for abuse, but then financial strain appears to override that. And it is noteworthy that, like, apart from the disruptions COVID brought about on, like, daily activities, family relations, etc., as of now, we do expect that economical downturn will, well, we could foresee economic downturn brought about by COVID in the future years. So this is something that we may want to pay attention to. And then on top of the survey results, I'd also like to share some of our observation, like elder abuse or mistreatment on the societal and structural level. I'm sure you saw some of these pictures in newspapers. So I think, like, we have a good supply or stable supply of surgical masks these days. But early on in the pandemic, we often see, like, old persons being sent off to queue for a surgical mask. And this is like an average queue, as you could see. Like, most of the people in this queue were actually senior citizens. So older persons, they may not have the necessary knowledge or equipment to shop for surgical masks online. Like, you need to draw lots or you need to queue, whatever. And then many of them may feel that they are obliged to go queue for a surgical mask when younger family members, they have other responsibility, they need to work from home, they got meetings, they need to go to work. And however, all those queues are generally packed with people and put them at greater risk of contracting the virus. And then another disadvantaged population are the homeless older adults. This is a public park in Hong Kong, which normally houses 70 to 80 homeless people. And, well, we have temporary closure of restaurant and fast food chain previously, and that forced a lot of what we call MAC refugees back to the streets. So MAC refugees are people who, like, spend the night at, like, 24-hour fast food chain to just sit there and rest. And then closure of facilities such as showers and football court in the parks, in gym facilities, they actually result in hygienic problems with this population. Most of them do not have a home, so they may need to use these facilities to clean themselves. And then social distancing measures also haunted regular charity and volunteer activities, so these homeless people may not get the necessary help they need. hospital and aged care facilities. I was talking to Dr. Leung just now, and we still do not allow visitation at aged care facilities. And there are some initiatives done, like using electronic equipment to help people reconnect with their family members. But given that all those visitations are banned during the COVID-19, people living in these facilities, they may lose their support and social contact. And that could increase the sense of loneliness and depressive feelings. And this change could be particularly difficult for older persons with dementia who may not have adequate understanding of what is happening. And then there are also older workers in low-paying jobs. I mentioned earlier that the COVID very likely will bring about economic downturn. And many older people and older workers in low-wage, low-skill industry, they are paid on a daily basis or even on an hourly basis. So they do not have any income protection. And many of them got laid off after the COVID-related economic downturn. And very unlikely that they will be able to find new jobs. So apart from older workers who got laid off, we also have older workers at high-risk jobs, carrying high-risk jobs without protective equipment. As I mentioned earlier, right now I think we have more stable supply of surgical masks and protective equipment. This is early on in the pandemic. So you could see that like this surgical masks were sold at a sky-high price, $230 per box. And there were reports, some sanitation workers, they were actually using second-hand surgical masks, which put them at greater risk of contacting the virus and various hygienic problems. So some workers are forced to work at high-risk setting, sanitation workers, toilet attendants, janitors, and they may not have adequate protective devices such as surgical masks and gloves. And there were a small survey done with sanitation workers, so like 149 of them interviewed. 30% suggest that they were not given surgical masks, and 40% were only given one surgical mask per day. I think it's generally recommended that you change your surgical mask after you have a meal or after you use it, after you get wet or something. And 85% indicated that they had not received any training in relation to COVID-19. So what we feel is that COVID-19 is bad, but it provides us an opportunity to rethink, re-examine, and reflect on elder abuse issues, both within and beyond the domestic setting. And in view that it will continue to affect many aspects of our life, we feel it is time to reconsider the current support we provide to older persons in the community and long-term care facilities. This is the end of my presentation. Thank you.